Hello, welcome to this video. My name is Christiana Mausisayra. I'm a public health practitioner. In this video, I would like to talk about 6 reasons why you should get tested and get vaccinated against hepatitis B. Now, what is hepatitis B? Hepatitis B is a viral infection, or it is an infection that is caused by the hepatitis B virus, and it affects or it attacks your liver. And it has so many complications, such as liver cirrhosis. That is when the liver becomes scarred and hard, so it's not able to function again. And it could also lead to, in fact, hepatitis B is known to cause liver cancer, a lot of liver cancer. So please, it is a serious condition, but the good news is that there is a safe, effective, and available vaccine against hepatitis B. In fact, it is also relatively cheap. So please, I will encourage you to get, tested and vaccinated. So the hepatitis B vaccine, it's usually given in 3 doses. So you take the first dose. First of all, when you walk to the clinic, you undergo the hepatitis B testing just to make sure you are not already infected. So the results come out and it's negative, and then you start with the vaccine. So you take your first dose, then you come back after 4 weeks or after a month to take the second dose. Then after 4 to 6 months, you come for your last dose, the third dose. And this vaccine protects you for at least 20 years. In some cases, it can give you a lifelong protection against hepatitis B. So please, let's not take the risk, but let's protect ourselves by, getting vaccinated. So now, and another key thing is that hepatitis B, there is no cure for hepatitis B. In case you are infected, you can only be given, there are treatments that you can be given to, relieve your symptoms and also prevent long-term complications. So there is no cure for Hep B. Now, why should you get vaccinated? The first reason is that you are sexually active. So because you are sexually active, Hep B can be transmitted through having sexual intercourse with an infected partner. It can also be transmitted from a mother to a child, to an unborn child. So the transmission can happen either while the child is during pregnancy, while the child is in utero, or during labor or delivery, or after delivery. You could also be transmitted, you could also be infected if you use, you share your nail clippers, your razors, and so forth, sharp tools with an infected person. So this is serious. Now, the first reason, let's come back to the first reason, is because you are sexually active. So whether you are already in a long-term relationship, or you are in a monogamous relationship, or you are in a you have multiple sexual partners, or you are starting a new relationship, please, I encourage you to get vaccinated against Hep B. You may not know whether your partner has it or your new partner has it, but once you get tested, you get vaccinated and you are protected. So it's very important. The next reason is because you were treated previously. Again, you were treated for a sexually transmitted infection. So what I'm trying to say is that in the past, if you were ever treated for gonorrhea, chlamydia, syphilis, trichomoniasis, and any sexually transmitted infection, there are high chances that you could also be infected with hepatitis B too. So please, and with hepatitis B this time around, you won't be lucky to get cured, because there is no cure. The treatment that will be given to relieve your symptoms and prevent complication, treatment is very expensive as well. So please, get tested and vaccinated against hepatitis B if you are sexually active. Then the next reason is because you could infect your child, your unborn baby, if you get pregnant. If you have hepatitis and it has not been diagnosed, and you are pregnant, the chances are that your viral load or the number of virus in your body would have multiplied, or the virus would have replicated, grown plenty in your body. So your viral load will be very high, and in that situation you could easily infect your unborn baby. So it is important to get tested. So if you are infected, you'll be given medication to suppress the viral load, so that the virus does not replicate so quickly, so that it keeps it at a very low level, so that your health and you cannot infect your baby as well. So your unborn baby is protected. And then if you have this viral load, there are chances that it would have affected some other parts, your immunity and so forth. So carrying pregnancy may be stressful, but once you go and get tested, in case it's positive, the doctors from day one of your pregnancy, or even before you get pregnant, they will support you medically to make sure you carry a safe pregnancy from start through to delivery. So baby is safe, mother is safe. Then the next reason is because you are a healthcare worker. So please, if you are a healthcare worker, you are a nurse, you are a student nurse, you are a midwife, any healthcare worker, you are a medical doctor, and you haven't taken your Hep B vaccines yet, I will encourage you to take the vaccines to protect yourself, because you understand, you are always coming in contact with patients. You are coming in contact with blood products, blood, and so many body fluids. So the chances of getting infected is even higher in the clinical setting. So please get vaccinated. The next reason is because you are a salon worker. You work at a hair or nail salon, or you work at a spa. I beg you, go and get vaccinated. Whether you are a hairdresser, hairdressers, sometimes when after touching up the hair for your client, you realize that the person has a lot of cuts. We call it cuts, or you have a lot of bruises or burns from the relaxer, and you go ahead and do the Rolex and everything, and most of the time you are using your bare hand. So you come in contact with the person's body fluid that is coming out of these cuts in the hair, and then the Rolex is contaminated. If it is not well cleaned, it is waiting and sterilized, it's waiting for the next client to come and use. So the infection could spread. So protect yourself. And sometimes even when you are doing the pedicure, manicure, you get cuts yourself. The nail technicians, you get cuts on your hand, on your fingers, and that exposes you to HIV, not only hepatitis B, but HIV as well. So please, I encourage you to get vaccinated. The vaccine is not expensive. So please get vaccinated. If you are a tattoo artist, if you are a hairdresser, if you work at a spa, if you are a nail technician, please try and get vaccinated against hepatitis B, so that you protect yourself and your family as well. Then the last reason is if you use the hair and nail salon. So, and eventually I know everybody will have one or two things to do, either at the hair salon, the nail salon, the barber shop, or the spa. So going there increases, you are exposed. And if you have not watched my video on the infections that are spread in the hair and nail salon, please do so. So you can get infected, you can get Hep B just because you had your nails done. You can get Hep B because you had pedicure done, and the equipment or the tools that were used were not sterilized before they were used on you. So you got infected. Why can't you prevent this? So please get vaccinated, because you do not know when you will come in contact with an infected body fluid. The barbers, please get vaccinated, because you are always shaving people. And in my previous video on the infections that are spread, I mentioned that there are cuts that occur when you are shaving people, micro cuts that you can't see. So you come in contact with the body fluid or blood. So please, let's get vaccinated. Thank you, and watch out for more videos. Bye.